Hello YouTube. I wanted to start off by saying that I'm very happy because my hair is looking fuller and stronger, more so than ever. I'm at my 14th month mark of my second FUE. For those of you who are new to my channel, I've had two different procedures. The first procedure I had at Hair Medical Restoration, and I got about 1,500 grafts put in the front area. And then about a year later, I wanted to increase the density, so I got a second FUE, and I got about 500 grafts put in the same area to make it look more dense. And it seems to be that's kind of the new norm now. I don't know, I doubt I was a pioneer, but I just think that just by chance I happened to get the second one, and it seems like it's a lot more common now. But anyway, let me show you, let me just get to the gist of the video. I'm going to show you my hair. So this is the front part. I'll comb it. I do have some product in the hair. Not much. I just have a leave-in conditioner and a little pomade. Alright, so there's the front part of my hair. You can zoom in. And you can see the density is pretty good. It's almost, the density is almost as thick as the rest of my head. Now let me show you the side. You can see there's very little scarring. And now let me go to the back. This is my donor area. And my donor area looks good enough to where I could fade it all the way down to a 1 or even a 0, which I do every 3 weeks. Unfortunately, because it's this crazy time that we're in due to the coronavirus, I might not be getting a haircut for a while, but we'll see. My barber is doing cuts out of his backyard, but I don't know if, I mean, especially at the rate we're going now, I don't know if that's a wise thing to do. But anyway, there isn't much else to show in this video. Oh, you know what? Let me show you one more thing too. I forgot to mention that I'm also this is all my 14th month mark that I've been on Minoxidil, which I'm treating mainly for the crown area. I use a generic Minoxidil twice a day in the morning when I brush my teeth. I mean, some people complain that it's a pain in the butt, but in my opinion, it's not a big deal at all. I brush my teeth. It takes me about 2 minutes to do that, and then it takes me about a minute, if that, to put in the Minoxidil. I just get the, I just put it in the front here, and then I apply. I think I apply a little bit more to the crown area, because that's what I'm most worried about. And for those of you who are that think that that are worried about it being inconvenient, it's not. It's super easy to do. But anyway, there isn't much else to show apart from the fact that I do love my hair and that I'm extremely satisfied. As I always do, I want to give a shout out to Hair Medical Restoration, to the Cortez brothers for doing an excellent job. I just also want to note that I'm not being paid by them or anyone else to advertise for their company. I simply want to just give information for those of you who can't afford a $40,000 or a $30,000 or a $20,000 hair procedure here in America, or whatever other country you live in where it's expensive, and that there's a good alternative where you can get a really good hair transplant at a fraction of the price. The last thing I want to discuss is that you know, that's I don't think I've ever mentioned it in any of my other videos, but I was meaning to. But the success of your hair transplant depends on your genetics, in particular how thick your hair is, how thick each individual hair is, how many hairs you have, the level of your current baldness, and the number of donor hair or donor grafts available. Fortunately, there are, I think, 4 different people that are posting their results from HMR on YouTube. There's El Tio Juan Carlos, who lives in San Diego. You can check out his channel, so you can compare the thickness of your hair to his, or Moises Amaya, Also, my boy Andy Millington from Australia also came up, and we went down together. And his channel is Hair Today, and you can check out his results. So basically, what I'm just trying to say is that we all have different thickness of hair, so you could compare whatever your hair looks like, and as a result, you could kind of get a good expectation of what your hair would probably look like after going to HMR or any other good surgeon. Now I'd like to thank all my subscribers for all the wonderful comments and messages and likes. If you are new to my channel, please subscribe. And that's about it. And I promise, I know I say it every month, I'm going to do a monthly. I know it's been a couple months, but I'm going to try to do it a little bit more regular now. Now that I just got my real estate license, so I'm no longer pressed for time as far as that issue. I do plan on giving you at least a 1 month update from here on out. Anyway, take care.